Can you explain how CoolSculpting complements traditional surgical procedures?
CoolSculpting is a great adjunct to the type of things we do at the plastic surgery office because we'll do surgeries for major body contouring, and there'll be patients that come in that really just aren't candidates for, let's say, a full tummy tuck. They might just have a little pooch on their lower abdomen or just a little bit of extra fat on their arms, and they might not really require a tummy tuck or liposuction. So CoolSculpting is a perfect avenue. I'll send the patients over to Amanda and she can take care of their problem. They don't have to have major surgery, and it's an easy recovery, and they're usually very happy with the results.
Excellent. How do you determine if a patient is a better candidate for CoolSculpting or a surgical procedure?
So we have patients all the time that come to the office, and especially recently there's this new advent of all the injections and the weight loss drugs. So we're having a lot of patients come in that have lost 30, 40, 70, 80 pounds. Those are the types of patients that are great surgical candidates because they lost so much weight so fast. They have a lot of skin laxity. And for those patients, sometimes they think CoolSculpting is the answer. They come to see Amanda, and unfortunately, although it's a non-invasive and non-surgical approach, it's not really the proper approach for what they need. And Amanda will send those patients over to see me. Sometimes the reverse is true, and I'll see a patient that really doesn't need surgery, so CoolSculpting is a perfect answer just to get rid of a small pooch or some fatty tissue around certain areas, let's say their love handles or under their chin. And so it's a great kind of union between two different technologies, the surgical versus the non-invasive.
Okay, great. So why don't you elaborate a little bit about the type of patients you are seeing that are coming off of Ozempic or Wegovy or the semaglutide?
Sure. I'd say in the practice over the last 6 to 8 months, quite a few patients that are coming in for consults are patients that we probably wouldn't have seen before because these are patients that had just stubborn weight and they had issues with that. They took these weight loss drugs. They lost the weight extremely quickly, and they lost quite a bit. Sometimes they even lost what I would consider a little bit too much weight. Because they lost the weight so quickly, they now have loose skin. They have loose skin on their arms, they have loose skin on their belly, and they've lost some muscle tone. So overall, they're not, even though they look better in their clothes, they've lost the weight, they actually kind of look in the mirror and aren't too happy with what they see. So they're coming to me now for breast lifts, tummy tucks, arm lifts, and like I said, it's things that they probably weren't thinking they were gonna need when they went into their weight loss journey with the Ozempics and the semaglutides. Sometimes some of the patients that I've seen have stopped because they've lost a lot of weight, and they have noticed by the time they got in to see us for a consult, maybe 3-4 months later, and they've actually regained a bunch of the weight. So we've seen that as well. So although the weight loss drugs are wonderful for losing weight, I think some of the patients aren't realizing how much loose skin they're gonna have as well as how much muscle loss they have. These are patients that unfortunately aren't really good candidates for CoolSculpting because their main issue is skin laxity.
So can you discuss the differences between medical weight loss treatments like Ozempic versus body contouring like CoolSculpting?
Right, so I think the main difference is, there's a few main differences. One is certainly that they're going to lose more weight with the weight loss drugs because that's what they're designed to do. You simply don't eat as much, you don't have an appetite, versus body contouring. And body contouring could be invasive. It's what we do at the plastic surgery office, liposuction, tummy tucks, etc. But CoolSculpting is also a non-invasive body contouring. The difference is that it's only targeting the fat cells. So the CoolSculpting liposuction is really designed to get rid of unwanted fat in certain areas of your body. When you take Ozempic, you're gonna lose fat all over your body. You're gonna lose it in your face, you're gonna lose it in your belly, you're gonna lose it in your butt, and That's why they end up coming to see me for the tummy tucks, the breast lifts, and so on. With liposuction or CoolSculpting, it's very targeted. You know, we only target the areas that someone's having problems with. So everyone likes a quick fix, and I think that's why these weight loss drugs have become so popular. But the other issue is that they also have some downsides as far as your health, problems with reflux, problems with digestion, and you know, that's just kind of the tip of the iceberg. We're not really sure because they haven't been around long enough to know how healthy people are going to be and what problems they have down the road. Plus, most people that I've seen have to pretty much stay on a maintenance dose, so they're just going to gain their weight right back. That's also a difference. When you do CoolSculpting or liposuction, you're basically killing the fat cells and they're gone forever. Like, they do not come back. You can make new fat cells. There'll be fat cells in other parts of your body, but those fat cells that are taken away with liposuction or CoolSculpting are gone for good.
You can't make new fat cells? Like if you're like...
Yeah, if you're morbidly obese, you can
definitely
make new fat cells.
Right.
But the fat cells, I should have said you can store more fat. Like,
yeah.
Fat cells are like gallon Ziploc baggies.
Right.
And you can have an empty one or you can fill it with lard. You know, and that's just one cell. But the fat cells we get rid of with lipo and CoolSculpting, they're dead. You don't have to worry about those filling up. But it doesn't mean you can't gain weight elsewhere.
Right. Which is why there's the misconception that CoolSculpting is like weight loss, but also the misconception that anybody who gets liposuction or CoolSculpting, the weight can come back somewhere else.
Right. The weight, if you have liposuction and you continue eating ice cream and French fries and steak, you're gonna gain weight. I mean, it doesn't prevent you from gaining weight because we have fat cells all over our body. It's just that if the fat cells, if you normally gain weight in your outer thighs or, you know, your love handles, when you take those away, you won't notice it nearly as much there. But you may notice it in your belly. It's gonna go somewhere.
So that's also a good reason why, if there has been anybody who's done something like tummy tucks or liposuction to an area,
right,
and they've dramatically decreased the amount of fat cells that's there. I just get a lot of like raw back fat after tummy tucks.
Yeah, I mean, CoolSculpting is a wonderful adjunct. When patients come to us for various procedures, you know, they're worried about a part of their body and they don't like it. That's why they're there. That's why they're at the office. So we'll do a procedure and they'll be so much happier, whether it's tummy tuck, liposuction. They'll look so much better in their clothes. They'll feel better. But I find that a lot of times, because they're women, they're kind of critical of themselves. So they'll continue to look at themselves more critically than maybe they did before. So whereas before a little bump maybe didn't bother them, now they're like, you know, Dr. Schantz, what about this? And I'm like, well, we could lipo it, but why not just CoolSculpt it? Because it's so much, you know, it's easy. It's non-invasive. They don't need another surgery. So it's perfect for like the touch-ups to surgical treatments.
Yeah, perfect. So when should patients consider choosing between a medical treatment like Ozempic versus coming to you all for an actual surgical procedure?
Okay. Yeah. So believe it or not, this is not infrequent in our practice. So when you come to the practice and you have extra skin and fat on your lower belly and you want a tummy tuck, or your breasts are droopy and you want a breast lift or implants, whatever it is, if your body mass index is over 35, we don't feel that we should do surgery on you because it's not as safe as it could be if you were under 35. That's kind of the cutoff. So I'll have patients that have lost a lot of weight, but they still might be, you know, they may have lost weight, but their BMI still might be 37, 39, 40. Well, they know they need a tummy tuck. We can see that they need it, or they need a breast lift, but they're not really great candidates medically. They're not at the point where they're gonna reap the benefits of what we're gonna do. Sure, they'll look better, but it won't be, they won't get the results that I think they're expecting. So those are the patients that we don't prescribe the weight loss drugs at our facility. It's just not something we do, but plenty of people do, as we all know. So, but those are the people that I tell, if they don't think they can do it through diet and exercise, then they should certainly consider that. You know, then they can get below, they get BMI down to in the 20s. Then they come and have their tummy tuck, and now we've cut off a whole bunch of that, so their chances of regaining the weight is also going to be a lot less. But the results are so much better. So I think, when they're not really medically ready for surgery, because it's not the safest thing, because ultimately these are all elective procedures.
Right.
We don't want to do a surgery, have someone get sick, and it's because they weren't really great candidates. So we really like trying to pick the best candidates, and they also have a vision for what they're going to look like when they're done. And if we know in our hearts that, sure, they'll look a little better, but is it worth spending $10,000 on a tummy tuck? It's not. They should try to lose that weight first, and that's where the Ozempics or the semaglutides would, I think, come in pretty helpful.
You can talk a little bit about how CoolBlue Lex, if someone's a good candidate for both, but maybe pricing wise, they could end up getting, the prices could be similar to something like liposuction. Sculpting, you're paying for, you're permanently killing the fat cells, no downtime, little to no pain.
Right.
No one has to know you've even had it done,
So we have patients that come in more for liposuction. We're not talking tummy tucks anymore. So for liposuction, and they really could be a great candidate for liposuction, or they could be a great candidate for CoolSculpting. And it's really, some of it depends on what the patient is willing to undergo. There are certain patients that don't want to take a week off of work, because for liposuction, you're going to have to take a week off work. Liposuction, it works great, but unfortunately, it's kind of painful, it's kind of messy, and it's a surgery. There's the risk of the surgery, and a lot of people simply just don't really want to go that route. So that's where CoolSculpting comes in, and I think there's a false notion that you come in, there's this machine, and it just freezes the fat, kills all the fat, and that's not really how it works. To do it safely, it kills a portion of the fat cells. So it's not unusual at all that Amanda is treating someone a second time or a third time, but she's targeting the treatments. So the first time she gets, let's say, the lower belly, and it looks so much better, but now we're noticing the upper belly or the flanks a little bit. So she treats that on a second treatment. So the cost of CoolSculpting can ultimately become very comparable to liposuction, but you're not having to have surgery. You're coming in for half a day or a couple hours, and you're going back to work or back to your activities. That's the biggest difference between CoolSculpting and liposuction. And there are a lot of patients that don't, frankly, they're scared of surgery. They're scared of anesthesia. They don't want to go that route, and I understand that. So.
And liposuction, like to arms or under the chin,
right.
or those areas that there might be laxity?
Probably some of the patients that I send to Amanda most frequently are patients that ask me, they've usually had another procedure in our office, and then now they're looking to what they can pick on themselves next. And a lot of times it's their arms, and they're showing their arms, and they say, I don't like my fat arms. I got my mother's arms and I hate them. And you can do liposuction, but sometimes liposuction, we really are concerned with if that skin will shrink back, right? So that's why for pregnant women, you do liposuction on their lower belly after they've had 2 or 3 babies, that skin's already stretched. That skin's not gonna shrink back. So that's why you don't hear of postpartum women getting liposuction on their belly very often. So the arms is kind of similar in that skin won't shrink. So if I do liposuction and I suck 60–70% of the fat out, and I leave someone with loose skin on their arms, they are gonna be less happy by far than they were with their fat arms, because loose skin is something that I can tell you from doing a lot of bariatric plastic surgery. Women hate loose skin on their arms. It's just something, they won't wear sleeveless stuff, they won't wear short sleeves, so you don't want to do that. That's where CoolSculpting is great, because CoolSculpting, you can take it in a stepwise fashion. You can CoolSculpt the arm, and you're going to see about a 25% reduction. I find that their arms just go from looking kind of pudgy to much more tone. Even though we didn't do anything to the muscle, that's really how it looks. That's the illusion it gives. And you don't have to worry about that skin being loose because you sucked 60 or 70% of the fat out. You only took a portion of it, and if they're happy and the skin looks good and they want a little more, you can do it again, and that's usually how it works. So it's great for the arms, and for a similar reason underneath the chin. We have a small, little, tiny applicator. They have applicators now for pretty much all over the body, but there's a little small one that fits right underneath here, and it's perfect for someone that has just, it's always a shame. Most of the time I'm doing liposuction to the neck, it's not a standalone procedure. I'm usually doing it with someone who's having another procedure, a tummy tuck or lipo elsewhere, because to put someone to sleep, you know, for that one reason, especially if it's just a small little tiny peppermint patty worth of fat, I mean, you should just cool sculpt it. So much easier. So.
Yeah, awesome. So then staying on liposuction, it's Sonobello?
Sonobello, yes.
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 So I get a ton of patients like crazy that are asking about the difference between the two. And I think it's just, you know, explain marketing and how it literally is liposuction.
Sonobello's been around for quite some time, and Sonobello has clearly just made a decision over this past 6 months. I mean, I think I've been seeing the ads since the fall, to really up their marketing, right? So they are marketing like crazy. I don't look on something on Facebook or Instagram and not see an ad. I rarely watch television. I'm usually just watching sports, and I see their ads, and they're promoting, you know, Sonobello like it's some novel concept, and they're promoting it for what they call, there's something lift or tuck, I don't know what it is, but it's a tummy tuck. So they're just doing kind of a dressed down version of a tummy tuck to get rid of loose skin. They're not doing a true tummy tuck, and they're doing liposuction along with cutting the lower skin off the belly. So you still have the same scar as a tummy tuck. The biggest difference, I think, is that these centers, they're doing all the surgery under local. So you're having liposuction done under local anesthesia. You're not going to sleep. You know, you might get something to relax you a little bit, but all this is done under local, which it can be done. I can tell you that I do procedures under local, and my patients usually pretty anxious. So I'd be really nervous about having to have kind of a pseudo tummy tuck under local. That's a big procedure. I also have never checked into what their pricing is. So usually when you have these bigger marketing firms, you know, they say, oh, we're gonna treat one area of Sonobello treatment is so much money. And you're like, great. And you go in for a consult, and before you know it, you know, they say that you have 10 areas that you need the Sonobello liposuction on. You know, your lower abdomen, your upper abdomen, your left flank, your right flank, your bra roll. When you come to our office for liposuction, if we say we're gonna liposuction the belly, it's one area, and we're doing the entire abdomen. So right now, there's a huge push, and I get a lot of questions about it, but there's nothing new in what they're doing. It's just liposuction and kind of a very small, modified tummy tuck where they're just cutting off the skin. They're not tightening the muscles in conjunction with the skin tightening. So.
Yeah, their mommy makeover is called Ab X.
Yeah, the Ab X.
Makes sense.
Yeah, so they have great marketing. You know, there's someone on there and says, I have this extra skin on my belly after my pregnancy. They just can't seem to lose it. Mm-hmm. And then the first thing he says, well, it's not your fault. You know, sure. I mean, that's what happens with pregnancy. It's not their fault, but they make it seem like it's not surgical, but it is. It's surgical. It is a surgery. It's invasive. They're cutting skin and they're cutting fat off in conjunction, I think, with liposuction. So all done under local. So I just know that when I do small procedures under local, and I did one today, and my poor patient they're just so nervous and anxious, and I don't think it's the best experience for the patient. The type of anesthesia we do at the office, we do IV sedation. We bring in, you know, certified anesthetists that put you to sleep. They don't get intubated, so they're not getting breathing tube. It's a very safe type of anesthetic. You just get some oxygen in your nose, but you're completely asleep. You go in, you lie down, off to sleep you go, and you wake up, the procedure's done. So, and when you come in for CoolSculpting, there's no anesthesia because you don't need anesthesia. It's I'm not going to say it's painless, but there's not much to it. You know, there's a little bit of discomfort when it's being frozen, and a little bit of discomfort when a man is massaging. But other than that, it's pretty close to painless.
Yeah, and it's very safe. CoolSculpting is, and then the type of IV sedation you all do is safe.
Yes.
And it affords you the ability to do your job better. I just couldn't imagine Not being asleep and every time you poke or watching everybody, that's around you.
Well, we did, my OR manager asked me a long time ago to fix a crooked C-section scar. And we would do it, she's tough, we would do it under local. And I said, sure, no problem, we'll do it one time at the end of the day. We finished, so she got up there, we localized, put the numbing in, we started cutting. Well, in the meantime, she decided that she wanted a little pooch gun, kind of like what they do for the ABX. And I was like, well, okay, no problem, if you want to try it. Well, she had a lot of scar tissue from her C-section scars. And essentially what we did was a mini tummy tuck under local. And I can tell you, she was grabbing my arm through the drape because she's wide awake. She had nothing but numbing because I couldn't get the scar tissue numb. And I mean, she made it through, but it was not a pleasant experience for her. I felt terrible for her. So.
Right. They say that it's safer though when they're using local, and it's just.
Well, that's not 100% true, because if someone is having a lot of pain, right, they are dying in pain, and you've given her a lot of local. There's a limit to how much local you can give. The big problem with that is it does not peak in your bloodstream for 12 hours. So let's say, we do it all by someone's weight. So let's say someone weighs, 80 kilograms. We know that we can give, let's say, between 50 and 60 cc's of the 1% lidocaine. Let's say you've given that and you go well beyond that because someone's having a lot of pain, and you just keep on giving it and you give 100 cc's. All's well and good. You might get them numb, they're fine. But because that medicine doesn't peak in the bloodstream for 12 hours, they could go home and have seizures. It could be lethal. It's not innocuous. It's not something that is totally benign. And so, you would hope that wherever they're doing this, they're doing it safely and they understand the limits. So, and I would expect that because you would think that'd be part of their training, but you never know. And that's the concern. Once you hit that limit, you're not supposed to give any more if you want to be safe about it.
Right, yeah.
Right?
Yeah, no, that's true. And then it says speedy recovery. How is it any quicker? It says doctors you can trust, where you all have the same nurses,
right. Well,
doctor, and then
doctors you can trust that's a nice thing to say, but what you really want to hear it say is board certified plastic surgeons. I don't think the lay public understand that you could be a family practitioner, you could be an internal medicine doctor, you could be a radiologist, and you can say, I'm a cosmetic surgeon. There's nothing in the laws, the medical bylaws that say that you cannot say that. You can say that. You went to a weekend course. You went to a weekend course to learn how to be a cosmetic surgeon. And unfortunately, most people don't understand that. They don't realize what board certification means. Board certification means, I went through 6 years of residency. I did a fellowship for a year in cosmetic plastic surgery, and I took tests. I took oral exams, I took written exams to get board certified. And every 10 years I have to be recertified. So just to say, trusted doctors, anyone can say that. That's once again, that comes back to marketing. So really, for any of this stuff, you want to look for a board certified plastic surgeon, or if it's for your face, board certified facial or plastic surgeon. So that's the big difference. And I truly don't know. I'm sure some of the Sonabella doctors are plastic surgeons, but I'm sure a lot of them are not. They could be general surgeons, other surgeons that they weren't that successful. So they get recruited by something like, Sonabella, and then they're cosmetic surgeons. So just buyer beware, that's all I'll say to that.
And then speedy recovery?
You're telling me this for the first time because I've never looked on their site.
Right.
I don't know. Speedy recovery in the sense that the type of their ABX tummy tuck is a much smaller version. It's kind of like a little micro tummy tuck, but liposuction is liposuction, and we all know liposuctions can be kind of painful to recover. I don't know that it's just going to be any quicker to recover. It might hurt a little less because with a traditional tummy tuck, we're tightening the muscles and we're undermining the skin all the way up to the rib cage. So it's just more aggressive type procedure to get a nicer result.
Yeah, it's called Tri-Sculpt is what the other one is called. So it's AbX or Tri-Sculpt.
Yeah,
Okay.
I'm not familiar with the Tri-Sculpt.
It says most patients are back to regular activities in 3 to 5 days.
Right. Well, I mean, depending on how much liposuction you do on someone, most liposuction patients can be back to activity in 3 to 5 days. If you do CoolSculpting, you can be back to activity the same day. You know, you can come in that morning, go golfing in the afternoon.
Right.
So,
I guess just the last thing would be what you think how CoolBlue Lex set is different than any other providers
facility?
that have CoolSculpting.
Sure.
My training, my experience,
Yeah.
being trained under you, like knowing who
Right.
would be a good candidate for CoolSculpting. That's like the biggest difference is that I'm partnered with you.
Yeah,
So-
I think one of the biggest differences, I mean, obviously our facility is beautiful, you know, but that really doesn't make a whole lot of difference in your result. It's just a nice place to come and be treated, whichever one likes. But the biggest difference is that Amanda came on board at our office originally, and it's a plastic surgery office. So I can't tell you the number of times I've had people come in for tummy tuck consults, and I look and I see all the loose skin, and I say, yep, you're a great candidate. And then they go on to tell me, you know, I wish I wouldn't have spent all that money on CoolSculpting. And I said, oh, and I usually ask them where they did it. And typically it's a med spa. You know, a med spa has only so many things that they can offer. So if you come in, you got kind of fat on your belly, they're gonna offer CoolSculpting if that's what they have. Even though that patient really shouldn't have wasted their money on CoolSculpting, they should have just had a tummy tuck. And that's the difference. You know, when Amanda sees patients over here, CoolBlue Lex, that are tummy tuck candidates, she doesn't hesitate. She picks up the phone and calls me, or we just get the patient set up for a consult for plastic surgery intervention, or if that's not really what they're looking for, then she sends them on their way because she's had the training. She knows where it's going to work and why it's going to work and why not to use CoolSculpting. You know, and I think that's one of the biggest differences. So it's a great partnership between the CoolSculpting that Amanda does and what I do. And she sends me far more patients than I send her, unfortunately, and she yells at me for that. But I, you know, we do send her patients as well when they need liposuction on their arms or underneath their chin. And you know, it's important to know that. And a lot of the other facilities, the people that are running the CoolSculpting machines haven't had any training. They haven't had the executive training that Amanda's had through CoolSculpting University, and she's also done this for how many years now?
Going on 7?
7 years. And a lot of these places, at these spas, their employees are, I hate to say it, but they're there, you know, they're in and out. So you've had someone that's done it for 2 months. How can you compare 7 years of training to 2 months? It's like saying, you know, the tummy tuck that I did, you know, a month out from when I first started compared to now 20-some years later. I mean, there's probably no comparison. You just get better. Experience makes you better. Amanda's done the most treatments here in the state of Kentucky, so that's what makes her good at her job. And that's why CoolBlue Lex is superior, we feel, to most of the other facilities here in town. I'm not sure if any of the other facilities are conjointly run by a plastic surgeon. There used to be one, but I don't think that particular surgeon's here in town anymore. If they are, I don't think they're doing CoolSculpting. So that's having the benefit of having someone who can look at you and tell you not to waste your money on CoolSculpting and being honest with you and say, but you know what, if that's what bugs you, you can go right down the street here, half a block down the street, and talk to Dr. Schantz and talk about plastic surgery, and I can get you in there a heck of a lot quicker than if you called on your own because I'm Amanda. So that's the benefit, and that's the expertise that we have that a lot of places don't have.
Right, excellent. PAH. So if somebody were to be actually diagnosed with PAH.
So there's a condition, albeit extremely rare, called PAH, paradoxical adipose hyperplasia. So big words, but all it means is that you got treated with CoolSculpting and the area that you thought was supposed to be smaller, the fat cells actually grew, they actually gained in mass. So it's very unusual. I think I've seen it in 10 years of having the CoolSculpting machines twice. And the company that's behind the CoolSculpting, it's AbbVie now, but they have like a warranty or a guarantee that if that actually happens, then you come in, you would see Amanda. Amanda would look at you, diagnose you, kind of have me second that. We send the information to the company, and the treatment is liposuction. So we understand that people have CoolSculpting because they don't want to have a surgical procedure per se. But in this case, that's how you treat this. And it's very treatable, and the company will pay up to, I think, is it $7,000? $7,000. Towards liposuction. So, and from where I'm standing as the partner who's a plastic surgeon, if that happens and someone gets PAH, then Amanda's going to send them over to me, and I'm going to take care of it. We own our OR, we control everything, so I don't think it's such a worry. You don't have to go outside the system per se to find another plastic surgeon. You already know it, so it's not something we've had to deal with. The two patients, one actually got treated by another plastic surgeon. I'm not even sure where. That was recently, and then we had someone about 4 years ago. That was the first time I saw it, and it was truly obvious. And I said, "Hey, would you feel okay with me doing liposuction?" I said, "I won't charge you a dime. We'll just take care of it. And, you've already spent money on CoolSculpting." And unfortunately, that patient said, "Yes, I would love to do liposuction and have a better result, but I'm moving next week." And they're moving to Atlanta. I said, "Oh, okay, no problem." And I said, "Well, when you get there, you get settled, and if you find a plastic surgeon down there, you let me know." And he did, and he just said, "Hey, I'm going to go ahead and get the liposuction down here." And we just gave him a complete refund of his money. This was before Allergan had their policy in place to do refunds. So, and we just want to take care of the patient. That's the most important thing. We want patients that are happy with their results from the hard-earned money that they spend.